Welcome back. Now, our health should be a priority. Of course, we've always been preaching it here on the floor in all of our shows, meaning you take care of yourself in ways physically, mentally, but don't forget you should include spiritually. This afternoon, we have Darrel Cousino here. He's the Director of Spiritual Health at Mercy Health Toledo. Here with more. Darrel, thank you so much for joining us.
Yeah, thank you. I'm glad to be here.
Now, when folks think spiritual health, we automatically go specifically to like an intense amount of religion and like this force it down your throat, but that's not necessarily what you're talking about.
No, not at all. So when we talk about spiritual health, we have to kind of define spirituality, like what we're talking about. So oftentimes we think of people in terms of like their intellect, their mind, we think of their heart, their emotional self, right? We think of the body physically, and it's helpful to break ourselves into parts to help to understand a little better. If you look at that as like a Venn diagram, those three circles overlapping, and then put a bigger circle around it, that's our spirituality. So that's the ways in which all of those parts are integrated and connect. And so spirituality is that experience of connection within oneself, feeling comfortable in your skin, feeling okay with yourself, accepting and loving yourself. It's that experience of connecting with others in conversation, in community, maybe religious community, maybe not. It's the experience of connection with God or higher power or with nature. And so it's more than religion. Religion may be a part of it,
sure, but
it's much, much more. It's about the human spirit, the human person, and all the ways that we connect and integrate all that.
So your job is not to, in a sense, because at Mercy, I'm thinking medical, I'm thinking health, I'm thinking, you know, more doctors, but you're saying they interconnect, and this is something that you want folks to at least be open to.
Yeah, so if spiritual health is that experience of connection, so then spiritual distress is the experience of disconnection. And so you think of the person who has a recent diagnosis, feeling maybe that their body has betrayed them, right? Disconnection from self, or feeling isolated from their family and friends, disconnection from others, or feeling, you know, is God punishing me? What did I do wrong, right? Disconnection from higher power. And so addressing that spiritual distress, focusing on some of those issues with our patients helps them to find their resources for connection and spirituality for their own health and healing. And so chaplains, we enter into that space of spiritual distress, and we're with people, and we're not there to push anything or anything, but to help them to discover their own spirituality, their own resources for health and healing from that perspective. And we got lots of research that shows that when we're attentive to those things, outcomes are better for people. Length of stay is shorter. People do well when we treat them as whole persons, right? When we address their spiritual needs as much as everything else.
Now, for you, how does it feel to basically be a part of something that you know, that you've seen has given more? Because of course, you're not the doctor. You didn't bring the bad news, or hopefully the good news, but you're there to kind of help folks along. What does that feel like for you?
To me, it's amazing to get to connect with people. I mean, it can be hard because sometimes you're there, you know, it's literally the worst day of their life, and it's such an opportunity to really share that human experience with one another. I mean, bottom line, it's about that, again, the connection, the love, the spirit that we bring to those encounters. It's compassionate care, right? And it's so meaningful. Yeah.
No, I love it. And so then with this, I'm hoping, you know, folks who are watching right now, if you are interested or if you feel like there might be a calling for you, are you all looking for more chaplains?
So yes, we always are. We have a program at St. Vincent Medical Center. It's called CPE, or Clinical Pastoral Education. And it's for folks who are interested maybe in discerning chaplaincy as a vocation or as a ministry, or maybe people who just want to learn more about how to listen to people, how to be available to them, how to be present. And we are you know, actively always seeking students. We have interns and residents and so forth. And you can be a chaplain and really have any religious background or even no religious background. You really just need to have a desire to connect with people and to help them to find their own resources, their spiritual resources for their health and healing. And so we're open to all folks. I'd be glad to have people call and talk to me. People can go to mercy.com/CPE, and that'll give information about our programs. And certainly any of our chaplains in any of our facilities would be glad to, share their experience and talk to folks who might be interested in learning more.
I'm sold. I appreciated it when I had a chaplain who came when a daughter was in the NICU, so I know it means the world, even if it's someone, we don't know each other, but it just felt better to not feel alone.
Yeah, exactly. It means it's a beautiful thing. Yeah, I love it. I love what I get to do.
Darrel, thank you.